massive explosion rocked the Lebanese capital of Beirut on Tuesday, killing at least 100 people and injuring over 400. Well, the blast occurred in the Port of Beirut, destroying buildings for kilometers around. Hospitals are overflowing and the number of casualties is still rising. What caused the tragedy and how is the city responding? I'm joined by He Wenping, Senior Research Fellow at the Chinese Academy of Social Sciences, and Makram Rabah, lecturer at the American University of Beirut in Lebanon, for the latest developments. And coming up later, we'll talk about the return of COVID to Hong Kong and China's response, also the pandemic in the United States. That's our topic. This is Dialogue. I'm Julia. Let me start with you, Makram. It was midnight in China, but the video of this massive explosion in Lebanon's capital, Beirut, has gone viral on social media, probably around the world, and the images are so shocking. What do you know about the blast?
Well, I know what I experienced as a citizen of Beirut and of Lebanon. This explosion that took place in the port of Beirut was heard not only in Beirut or in Lebanon. The actual sound went all the way to Cyprus, which is an adjacent island to Lebanon. And it was so terrible and so catastrophic that it actually didn't only destroy the port of Beirut completely, but it also turned the whole city of Beirut into a war zone. I had the chance to actually survey the ground late at night. Some areas are unlivable and many of the structures cannot be inhabited, adding to the fact that people in Lebanon cannot afford now to renovate their houses because simply their money is stuck in the banks and they have no ability to actually spend money. And more importantly, the destruction of the port of Beirut has destroyed the country's silos of wheat and flour. So we are actually not only looking at a geographical catastrophe, but we're also heading towards a famine of some sorts.
But your Prime Minister, Hasan has been saying the cause is explosion of over 2,000 tons of ammonium nitrate that has been stored in a warehouse for 6 years. And he said this is unacceptable. Why such large quantity of highly explosive material will be stored in a warehouse for 6 years without anybody attending to it?
What is unacceptable simply is Hasan himself, who is insisting that what happened yesterday was a kind of a mishap or a wrong handling of chemical elements. Yesterday the explosion did include nitrate, but there was actually another explosion that took place before, which led to the augmentation. The nitrate actually led to the augmentation of this blast. So Hasan is insisting that this is a natural accident, whereas many people, including myself, say that there is a Hezbollah Israeli element here, which we also need to explore. We might be barking up the wrong tree, but still, as Lebanese citizens, we do not have full trust in the ruling establishment, and particularly the government of Hasan to conduct an open and transparent investigation. And this is why there are calls for international mediation or for international committee that looks into what happened yesterday afternoon in downtown Beirut.
Madam He, obviously there were different reports about the cause of the blast. And do you think it might have something to do with the different political factions in Lebanon? Could it be done deliberately by humans?
Well, this is really a shocking, accident happening. At the very beginning, honestly speaking, because I went to bed normally very late, so I also, the first time I got this news, and then the first thing came to my mind, I think, oh my God, maybe terror attack, yeah, maybe something happening between Lebanon and, recently Lebanon even had some war conflict with Israel. So lots of ideas immediately jump into my mind. Actually, I didn't think about this is this chemical, those material has been kept there for as long as 6 years. But now, even the President Trump At first time, he said this is attack. He said this is attack.
But both Israel and Hezbollah has denied.
Yeah, they
any
denied.
involvement.
Yeah, now it seems now all the reasons now is coming from that very dangerous. Yeah, almost like 3,000 tons, those chemical, very dangerous chemical material. But we can also refer this to a big background about this, instability in this country for such a long time. Why this kind of criminal things will be happening, like 6 years, even just located not far from those very populous places. I heard this like light club is just over there, very crowded shopping area, just steps away. So this is a criminal behavior, I think. So this relates with this country. It suffered for quite a long time.
Yeah.
Yeah, especially in the recent years. You see, now they are under three kinds of, pressure. One is this economic chaos. Yes, since last year, I think people went to the street even to protest because the inflation rate is very high. Now even the exchange rate with dollar, official rate is saying 1,500 local currency, and then with $1. But actually the black market, the real is 8,000 more. So people even cannot afford like bread, not mention those, meat, beef, whatever. So, and then COVID-19 also there.
Sure.
So plus, now the government change very often. So if a government change, because the former prime minister just resigned under this such pressure, and then the new prime minister stepped in just since earlier this year. So you see this administration change, and people need to get used to all the bureaucracy system.
Right.
So nobody take care about what kind of a potential danger in this country, where it is. So I think those are the big background.
Yeah, Macron, as Madame He just explained, probably this came at a very bad time for Lebanon. It's a triple whammy in a way: political tensions, economic difficulties, and now this. Can the Lebanese cope with such difficult situation, and what needs to happen for them to get back on their feet? My grandma is still there? It seems we have lost audio with Macron there. But Madame He, as you explained, this is a very difficult challenge for Lebanese, who is now facing political uncertainties and economic difficulties. But do you think this tragedy will be the last straw on the camel, or it probably inspire Lebanese to come out of this?
I think because now there's a big tragedy. So in this point, the people now, the short term is people focus on this, how to rescue the people, how to do like treatment to those wounded people. So now even the city mayor of the Beirut also call all the Lebanese people pull together, united together to overcome this big challenge they have ever seen before. So I think if
will they unite?
I think so, because this is a big challenge now facing all the people, no matter you're coming from different religion or coming from different party. But if at this very critical point you still want to fighting for your own interests, that will against all the interests coming from all the people. You're doomed to failure for your own small political interests. But in the long term, I won't say it's always like promising, because some party, they will make use of this accident and then to attack another party, because this has been, in the last not only years, even decades. We know Lebanon has suffered for as long as 15 years civil war.
Do you mean parties within Lebanon, or do you mean the regional powers who would be involved?
All the parties within Lebanon, and then they have their backers behind them, all the regional powers. Like Hezbollah, we all know this is an open secret. They have been backed, from the Iran. And then other party, they are backed from, other Syria or other powers. So they are all coming from those regional powers, even beyond the region. So like Russia is the first time they send their rescue team to Lebanon. So this is the very first, response. But also means Russia has lots of, relation with this country, and the United States similar. United States imposed a very strong sanction to Lebanon during the past time. Even some people saying this is also indirect impact, caused Lebanon's economic chaos. Because those sanctions imposed by United States, they are saying goes to like stop the Hezbollah to gradually expand their influence in the parliament or military.
Do you think this accident will change some of the calculus of those Lebanese politicians and those outside forces? For example, will U.S. lift the sanctions? Will the economic situation in Lebanon improve?
Yeah, it also depends on the investigation going on about this big,
the
tragedy. Tragedy. So, like this goes back to 6 years ago. So 6 years ago, who is in power? It's not this current prime minister. His responsibility. Now the current, the sitting prime minister is calling for this investigation, saying anyone if take the responsibility for this tragedy, and then there's no message about this. So you can trace back all the way to 6 years ago. So who did that, to capture this chemical, such 3,000 tons in that warehouse? So who will take this responsibility? And then you trace back here and there, a lot of issues.
How long do you think the investigation will get to the conclusion?
Yeah, as our colleague just mentioned, even Lebanon themselves maybe is incapable to do this investigation.
So there's going to be an international team.
Yeah, they ask an international team. But the mayor, the city mayor saying, oh, I wish to have this report as earlier as within 5 days. But I don't think it's possible.
It's possible. All right. Thank you very much, Madame He, for your analysis. You've been watching Dialogue here on CGTN. We'll be right back to talk about COVID. Well, 7 of 60 proposed virus testing experts from the Chinese mainland arrived in Hong Kong on Sunday to help the city deal with the third round of COVID-19. Although the help is much needed, the move hasn't been welcomed by everybody in Hong Kong. So what about the resistance? Will medical support from the mainland help make a difference in the fight? Meanwhile, the U.S. are still struggling with the world's biggest number of cases and highest death toll, and how are lives valued in the election year. In this part, I'm joined by Dr. Christopher Hui, consultant in Respiratory ID and Critical Care Medicine, Hong Kong, COVID-19 Task Force, and Dr. Megan Ranney, emergency physician at Brown University. So Christopher, COVID-19 is hitting Hong Kong, and for the third wave this year. Actually, more than 100 new cases were diagnosed over 12 days on end. What are your thoughts on where we are in terms of the outbreak in Hong Kong?
Yes, thank you. When the first wave of COVID hit Hong Kong in January, there was widespread concern and even panic buying to an extent. However, the numbers were very small at the time. When the second wave occurred around about March, there was concern that some of these cases were being imported into Hong Kong from outside. And so the government took quite drastic action to close the border to non-residents and to limit access to the city to prevent the continued spread of the disease. So now, as we enter this third wave, I think there are concerns that these measures have worked very well up until now, but there are perhaps loopholes or considerations where exemptions have been allowed, which have perhaps contributed to the current situation. With the benefit of hindsight, I think it was probably difficult to tell at the time, but going forward now, we probably have to be more careful.
What is the major contributor to the resurgence this time?
Sorry?
What is the major contributor to the resurgence this time?
Well, we think there are two factors. One is the fact that the quarantine in the early months around March and April permitted people to quarantine at home rather than in designated centers. I think we can all see from a humanitarian perspective this makes sense for people to be more comfortable, but it also puts them into contact with family members or a pool of loved ones in their own immediate community, where they may be potentially able to then spread further. The other one is the concern about exemptions. There have been something like 200,000 exemptions to date in Hong Kong, despite the closed border, and I think that has to be something we have to look at again.
And the mainland has sent help, medical supplies, and even medical experts to Hong Kong to help. But do you think the mainland team will be much of a help for Hong Kong, and why are they not welcome in some parts of the city?
Well, I think, you know, very much the situation everywhere in the world right now, any help that we can get is very much to be welcomed. I think we can only do well in battling this pandemic by sharing our knowledge, experience, and expertise. And I think China has demonstrated that across the lockdown in Wuhan and Hubei, and also with the testing, the widespread sort of at-scale testing that has been executed, I think it's the teams that we're talking about have demonstrated exceptional sort of capability in these areas, and I think there's a lot to be learned from this exchange.
In terms of testing, how widespread is testing carried out in Hong Kong? Because the mainland experience, whenever there is a cluster happening, there will be massive testing in the populace. Will that happen in Hong Kong?
Yes, that has been happening to an extent. Again, I think a lot of this is to various degrees, and a lot depends on the local capability to scale up testing. Certainly in the early months, in January, February, and March, I'm aware that the testing capability in Hong Kong, like in many other parts of the world, was not perhaps at the same scale, but necessarily so, because we are a smaller city of just 7.5–8 million people, and in context of China with a population of 1.4 billion, I think these are different scales.
In terms of the pushbacks to the mainland's reaching out to Hong Kong, there are Reuters reporting that local councillors have raised concerns that Beijing might be collecting DNA samples for surveillance purposes. So that's why some Hong Kong people are suspicious. Do you think this concern is legitimate? Does it make sense to you?
No, not really. I think, having worked in hospitals on both sides of the border in Hong Kong and in Shenzhen in Guangdong province, I can assure the general public that the standards of practice, professional conduct, and information governance are very much the same, if not stricter, on the mainland. Furthermore, I think there's no need for concern, because this is not a discussion about transporting samples per se. Specifically, if you're talking about testing for COVID, then the primers that are necessary are very specific for just detecting the virus, and so there shouldn't be a debate about anything broader than this as the subject.
And do you think with the current measures in place and with the help from the mainland, this third wave will be contained anytime soon? And what do Hong Kong people feel about it?
Well, I think we can be confident that given a little bit more time, we will be able to contain it. It's a matter of testing, of everyone cooperating. I think this is something that everyone across the community has a stakeholder in. We all understand the importance now of hand hygiene, of washing our hands, social distancing, and ensuring that we cover our cough and wear masks in public places. And I think this is important going forward, as we allow a little bit of time and the experts and the teams involved to manage the situation properly.
And another thing is the makeshift hospitals, those prefabricated hospital wards in some stadiums, as has been carried out on the mainland. On August the 1st, Hong Kong's first temporary hospital also opened. Those hospitals proved useful and very efficient elsewhere, especially on the mainland. But are those facilities also welcomed by Hong Kongers, and will they be working as they did in other cities on the mainland?
Well, I think there'll be a lot of understanding for this. In January and February, because the numbers in Hong Kong were relatively small, our existing infection control departments and isolation wards were more than sufficient to cope with the numbers of cases that we were seeing. However, as we move forward now to this third wave, I think there's anticipation, growing awareness that potentially the numbers could be greater than before. And so with that, we really do have to prepare in advance. And I think this makes a lot of sense. As we've seen from the experience across China, in Wuhan and in Shanghai with the Fangkang Yiyuan, and with the Nightingale Hospital in the UK, which I was involved in advisory for, a lot of this helps to prevent and allow us to provide doctors and healthcare workers with the space to workflow and to allocate isolation facilities to individuals to reduce the risk of cross-infection and cross-contamination in crowded hospitals. And I think it makes a lot of sense as a strategy.
All right. Thank you, Christopher. Let's talk to Dr. Rani from Brown University. Dr. Rani, according to Deborah Birx, the White House coronavirus response coordinator, the U.S. has entered what she said, a new phase of the pandemic. How should we understand this new phase?
So in this new phase that we're in the United States, the coronavirus infection is not limited to a specific geographic region. It is truly across the United States. We are seeing hotspots in almost every state, and the numbers are just growing day after day. It has escaped the point where we can effectively contain it in a specific geographic area at this moment without resuming stringent shutdown or lockdown measures. That would really be the necessary next step right now if we were to hope to bring it back down to the levels that we had it at in early May.
Why the infection cases went down for a period of time and then it came all the way back up? What happened?
Well, the early hotspots of the infection were really geographically concentrated in just a couple of areas, in the northwest of the country and in the northeast of the country. We managed to get those under control, but then some of the states that had small, smoldering numbers of infection reopened very early before we had adequate public health measures in place in those states, so before we had adequate testing facilities, personal protective equipment, and certainly before the case count numbers in those states were dropping. That served as a hotbed or a nidus to allow infections to quickly skyrocket. Here in the United States, we've had a number of big national holidays over the last couple of months, which brought a lot of people together and allowed that virus to quickly spread. And now, unfortunately, it is somewhat out of control, particularly in our southern states.
So we are facing a very difficult dilemma. The cases is close to 4.8 million, the death toll approaching 157,000, but the federal government is still sticking to its view that the schools must reopen. As you said, opening up could be a dangerous thing. So how struggling are the U.S. Schools and parents and students facing what is happening now?
You know, I think this is the question on the mind of every American parent right now. There are really no right answers for schools in the United States. On the one hand, the way that the United States safety net is set up, if our schools don't open, parents who work don't necessarily have a safe place for their children to go. And we know that being in person in schools is better for kids' academic, physical, and emotional health than being home. On the other hand, because we have not successfully controlled this virus, because we don't have testing, because we don't have protective equipment, it may not be safe to the kids, but even more so to the teachers, the staff, and the communities to reopen schools. So we're really caught between this rock and a hard place. It's unfortunate because we know from other countries that if you control the number of COVID-19 cases in a community, you can reopen schools. But in the United States, we have largely prioritized reopening bars and restaurants and social activities over trying to get those cases down so that we can reopen schools.
You mentioned inadequacy of tests, but President Trump kept saying the high number of cases is because of widespread testing. Wider testing reveal more cases. What's wrong with this logic?
So certainly, if you are testing a wider number of people, it is true that you will identify more cases. Very early on in the pandemic in the United States, we had very few identified cases because we simply could not test anyone, even patients who were being hospitalized. It was virtually impossible to test. So there is a small grain of truth in that statement. However, just because we are identifying more cases does not mean that it's only because we're testing more. The reasons why I say that are two things. First of all, our test positivity rate is going up, which tells me that we actually are not testing enough. We are not picking up all of the positive cases in the community. The second reason is because our hospitalizations and our deaths are also going up. That does not depend on testing capability. We're seeing between a 30 and a 60% increase in deaths from COVID-19 in many regions across the country. That is not dependent on testing. And so to claim that those cases are simply due to testing is just not true.
Yes, as you said, the hospitalization and death rates are still very high, but for the government, especially the federal government, they have to make a decision how to balance economy with virus control, because the economy is tanking right now. So do you understand that this difficult situation for the federal government?
Oh, I understand this situation all too well. In my home state of Rhode Island, we are struggling with how to support our small business owners, folks whose jobs have been lost due to closures from this pandemic. It is a very, very real issue, and it keeps me and many other public health specialists up at night. But I will highlight that the biggest danger to the economy is not the closures, it is the virus. People stopped traveling and stopped going to restaurants in early March before any shutdowns were instituted. We continue to see in states with high rates of COVID-19 that people are not moving around as much and not spending as much because they're afraid of catching the virus. The best thing we can do for our economy is to get COVID-19 under control, and then we can really reopen and restart our economy. The other thing, of course, is how to support all of those folks who are in difficult economic situations right now. I have too many friends and community members whose businesses are struggling or closing. This is a real problem. But again, the best thing we can do is to control the virus in order to help our economy.
Doctor, I have 30 seconds left. Will a vaccine solve the problem, be a silver bullet in half a year?
No. The quick answer is no. We have to wait and see which vaccine works, if any of them. Then we have to manufacture it, and then we have to get it to people. And that's assuming that the vaccine has 100% efficacy. There are so many steps between creating a vaccine and having it get rid of this virus. COVID-19 is going to be with us, hopefully at a lower level, but it is going to be with us for years to come.
All right. Thank you so much, Dr. Ramli, for your insights. And you've been watching Dialogue here on CGTN. I'm Joe in Beijing. Thank you for watching. Goodbye.